Autism is a condition which affects how children and young people communicate and interact. It's not a mental health problem, but someone who has autism may be more likely to experience mental health difficulties. Sometimes, a child or young person with autism can lack self-esteem. They feel overwhelmed with life and struggle to ask for help. They may face challenges with communication and social interaction. They can also experience anxiety around change, acceptance, and sensory processing difficulties. These challenges present fundamental risk factors to their mental health and well-being. Many children and young people may be awaiting assessment for a diagnosis of autism. They may not know how to access support or find it difficult to get the appropriate level of support. So, the risk to their mental health may be overwhelming, and they might need additional help, especially when they're struggling with their emotions and become dysregulated. They may find alternative, unsafe ways of coping with their mental distress, such as turning to substances, including alcohol, or self-harm, or have thoughts of suicide. People with autism may have a high use of alcohol or illegal substances, especially when there are other mental health conditions involved. An estimated 1 in 5 teens and young adults receiving substance misuse treatment may have undiagnosed symptoms of autism. Sadly, a leading cause of premature death among people with autism is suicide. This is why training and resources are crucial in raising awareness of this issue. Staff within services may not be autism aware or confident in their knowledge and skills, which can make access to their support difficult for children and young people with autism. There are many reasons for this: lack of training and awareness, misinterpretation of behaviours, rigid protocols, stigma, and fear. Children and young people are often forced to modify their autistic behaviours to cope in a society that's set up for people who are not autistic. This is known as camouflaging or masking, and it can increase feelings of loneliness and not being accepted. Many experience sticky thinking and may hyperfocus, which can include thoughts of suicide. This can make it feel like the only escape, but with the right support, these thoughts can be managed. Children and young people with autism are more vulnerable to negative experiences, such as navigating friendships, which can cause isolation and increase their risk of attempting suicide. Some professionals working with these children and young people can feel less confident asking about suicide planning compared to those who don't have autism. Not asking the question about suicide can lead to important information being missed and a lack of appropriate support to keep them safe. Research has highlighted several factors linked to increased mental health risks for children and young people with autism, including routines and stimming, which can be beneficial, but changes in these behaviours might be an indicator of concerns. Emotional dysregulation, being unable to understand or manage their emotions appropriately, may be associated with an increased risk of suicide. Low mood and overactivity or impulsivity can also predict the presence of self-harm. Alexithymia, difficulty identifying and describing emotions, have been associated with further increased risk of suicide. Poor sleep contributes to an increased risk of suicide in people with autism. It's crucial for everyone working with and caring for children and young people with autism, regardless of their diagnostic status, to understand the difficulties and challenges they face, why they're more likely to have thoughts of self-harm and suicide, which they're unable to articulate, and most importantly, what we can do to support them and keep them safe. Visit the website to find out more about suicide prevention training and resources available to support children and young people with autism.